everyone. Welcome to another session of Physio TV. I, Dr. Rucha Reyes, Assistant Professor here at Sanjeti Institute College of Physiotherapy, Pune, welcome you this World Heart Day 2022. Today, as a part of this celebration, we have a talk by the well-known Dr. Raziya Nagarwala, who is a professor and head of Department of Cardiovascular and Respiratory Physiotherapy Department here at Sanjeti. Ma'am will be speaking to us today about prehabilitation and lifestyle modification. I now request ma'am to begin with the talk.
What is prehabilitation? Prehab is nothing but a participation in therapy-based movement and exercise in order to avoid the disease. Is just now Dr. Prajakta had spoken about risk stratification and about the screening. So you're going to screen the subjects that they are not having any cardiovascular disease. That means there is no sign and symptoms. They are at a low risk who can be included in prehab in order to avoid the disease in the future, in the life to come. So they are the ones who are not at a risk, or if they are at a risk, they are properly controlled by the medications. And this is what we are trying to include them in our prehabilitation. So why we are talking about this all prehab and to avoid and prevent the disease and promote the healthy heart? Because just Dr. Firodia had spoken about and given us all these numbers. So these numbers means why they are important, because we know if we see the statistics, the cardiovascular disease is at the largest of the cause of the death in the global, that is in the worldwide, and also in India. If we see about in India also, the number of the death occurring because of the cardiovascular disease is very high. The most comprehensive analysis of physical activity patterns across the India has found the number very alarming. So Global Action Plan for Prevention and Control by the Non-Communicable Disease in 2013 to 20 study has given us the more emphasis on preventing and controlling the cardiovascular disease. And this we can do it by lifestyle changes and managing the risk factor, and whenever needed, prophylactic use of certain drugs. So now what we mean by prophylactic uses of certain drugs? These are like, subjects who are found to be having a pre-diabetic, or those who are at a higher weight, obesity means, they are who can be given certain drugs in order to prevent them getting into a cardiovascular disease. So one don't have to wait a person to get a coronary artery disease. We can manage them before they go into a disease process. The risk factors, Prajakta Madam had spoken about the risk stratification and risk factors. There are numerous studies have been done who have come to a conclusion that what are the risk factors. These are not only the Framingham, the most spoken Framingham heart study, which was done long time in 1949, but recently European country also have given us this risk stratification and risk factors for the coronary artery disease. And we all know there are non-modifiable risk factor and modifiable risk factor. So if we know this risk factor, we know how we can control by changing our lifestyle. And that's what we are going to speak about, lifestyle modification. Because fine, age, gender, genetic factor, race, these are all non-modifiable risk factors. But by changing our lifestyle, by controlling certain factors, we can still control the coronary artery disease. So we are talking about this all modifiable blood pressure, diabetes, yes. But in today's world, the world where we are living in today's world of competition, the stress is a major buster. Hence, we have today with us a clinical psychologist who is going to speak about the stress and stress management, because everyone is living under the stress. It may be children who are school going towards the adult to the old age. The stresses are different in everyone's life. So stresses their stress we have to identify and tackle them very carefully in order to prevent them going into a burst. So the most important way to prevent the atherosclerotic vascular disease, heart failure, and atrial fibrillation is to promote a healthy lifestyle throughout the life. So as we always say, prevention is better than cure. So one has to take an action to prevent and promote a healthy lifestyle. And how can we do this is simple by this A, B, C, D, E, which we are going to look into it. As we say that certain drugs are used, medications are given as a prophylactically. So those who are at a high risk can be given the prophylactic medication in order to prevent them going into a further problems, right? So aspirin can be taken or certain medication in order to control the body weight or a medication to control the blood pressures, like the statin is given in a certain case where they found that their patient is already having a high cholesterol in the body. They can be given statin early in order to prevent them going into a hypertension and going into a coronary artery disease. So we will see what are these hacks of lifestyle changes. The most important, people smoke, and when you ask why they smoke, they themselves don't know why they are smoking. Maybe certain time because of the stress, or sometimes just it's a lifestyle. So after cigarette, as we all know, they are not good for the health. Of course, everyone knows about it, but then also people take, they do smoke, they do drink. No, there are people who knows the ill effect of it. So after a year without cigarette, risk of heart disease drops to about half that of the smoker. So we have to promote for non-smoking because cigarette contains many chemicals and around 400 chemicals, something more than that. And now how it helps, I mean, how it is disaster because it increases your blood pressure, increases LDL, decreases your HDL and damage to the arteries. And once the arteries are damaged, we all know that it will promote the atherosclerotic thrombosis and leads to the CVD. And hence, this is where we have to work in order to promote a healthy lifestyle. Alcohol, yeah, small amount of alcohol, it says that it is a good for the heart. But in a large amount, it aids fat and calories and increases the blood pressure. It also increases your triglyceride. And another thing, the alcohol may precipitate cardiomyopathies. Hence, the alcohol consumption has to be under the control. Also, our alcohol can lead to atrial fibrillation, again, which can lead to blood clot and cardiovascular disease. When I'm talking about cardiovascular disease, includes your heart and the vessel, and that's why even we are talking about the stroke. The chances of getting stroke becomes high. About a healthy lifestyle, we cannot forget about our healthy diet. And I'm not going to speak about this. This is the pyramid which we have to follow and not the reverse one where we have lots of junk food and the high fiber is at the top level. So this will be spoken by the nutritionist and dietitian we have today, Dr. Mr. Nidhi Mehta, who will be speaking on this. About most important is maintaining a healthy weight. And that's why we talk about the calorie intake and the calorie expenditure. The expenditure has to be more than calorie intake. And that only is the way to maintain our healthy weight. The way obesity, once you control your obesity, you know you can control your diabetes, and that's how you can control your going into a metabolic syndrome. And we all know that metabolic syndrome, patient with a metabolic syndrome at a high risk of developing the coronary artery disease. So again, in having the healthy lifestyle is to have a good quality of sleep. Again, as I said, today we are living in the world of competition. Plus, the whole cycle is changed because maybe the working habit also. There are the people who are working in the odd hours, they are working in the night shift and all, and this disturbs the quality of sleep and make the stress and leads to a coronary artery disease. So we have to incorporate a good quality sleep and good lifestyle with important is about the health screening. So those who are at the age of 30, 35, 40, they should go regularly for their health screening where they can screen for blood pressure, diabetes, about their weight, ECG, and thus we can prevent the cardiac disease. As I just told you that the stress is the main, again, another factor which we cannot forget, though it is not there in the list. We talk about the behavioral pattern. Now, the stress could be due to any reason. It cannot be just a stress. It could be a family, socio-economical problem because of the adverse life events in the family. So all this leads to a behavior pattern also is the another thing about the stress, and one has to manage the stress. Now we are talking about the multitasking. There are the people who are doing multitasking. I'm not talking today in the era where only the women are having multitasking. The men are also doing multitasking, and that is leading to the stress. And one has to work in order to relieve this stress. Where I'm not going to speak much about the stress management, as we have a session where we will be speaking about the stress in a cardiovascular disease and how. So the most important thing is to have a life, look at the life with a positive attitude and relax, incorporate into meditations, yoga, which may help in reducing the stress. Is already Dr. Manish Firodia has spoken about certain disease like diabetes and a blood pressure. Blood pressure, it is very important to control the diabetes in by not only by medication, but incorporate a healthy lifestyle, and that is what we are talking about. Exercising. So physical activity will reduce diabetes because if you perform exercise at least for 150 minutes per week of moderate intensity and 75 minutes of vigorous intensity, it will improve the glycemic control and also will help in achieving the weight loss. And this will help you in controlling our diabetes, blood pressure, the same thing. The aim should be to maintain your blood pressure by 130/80. That is what is the aim. And this also can be promoted by living a healthy lifestyle. And this we will see about the most important part is physical activity. Because today's world, we are all living in the world of finger, everything is available on the fingertip. You don't need to go to the mall to walk and get the vegetable. That also you get at home. And this has led to physical inactivity. So most important part of our lifestyle should be is the physical activity. One has to exercise in order to promote the healthy heart and a healthy lifestyle. So walking is the best. So be physically active. Is a report from the US Surgeon General report, which says that inactive people are nearly twice as likely to develop heart disease as those who are more active. So the physical activity will sure 100% will help us in promoting and living a healthy heart life. So the ICMR and NDB study, which says that women are much more far active than the men, less active. And in a study population, 54.4% are inactive, while 31.9 were active and 13.7 were highly active. So this data itself tells that today's era, we are very inactive in our lifestyle because maybe the urbanization, ever digitalization, all had led to our physical inactivity. So, in order to avoid this physical inactivity and promote the healthy lifestyle, one has to incorporate exercise in the lifestyle. So, 45 to 75 minutes of brisk walking each week appears to reduce the relative risk for adverse cardiac event. Now, this exercise could be in the form of walking, or maybe you are going to the gym and exercising using bicycle would be the best thing. So, incorporate physical activity in our life. That is the most important thing. So, why exercise? Because exercise has beneficial effect because it reduces the adipocytes mass and body mass index as well as positively affecting insulin sensitivity. So if we see here, this is just a diagram that, okay, we are all working. Maybe there are people who are in the IT or if today's era where everything is on Zoom or online study, online activities, we have to, between our daytime, there should be some time which we have to put it for our physical activity and exercise so that we become physically active. So exercise benefits, I say, is multiple. So why? Because not only it will help in our healthy heart by improving our cardiac function, by increasing the systolic volume, sorry, stroke volume, the arrhythmias. So by incorporating exercise in our lifestyle, we can control the blood pressure. It will improve our exercise capacity and exercise tolerance. We will be able to control our body weight because when you exercise, it increases your leptin production, which will help you in inhibiting your hunger so that you know your intake itself will become less. And what we say just now that you have to balance your calorie intake with a calorie expenditure. So improve your calorie expenditure. It will help in decreasing the blood pressure by not only causing the vasodilation, but improving the endothelial function of our arteries, and thus it will also reduce the blood viscosity. Exercise also will reduce your LDL and improves the HDL. Exercise also will improve your insulin tolerance by your increasing the sensitivity of the GLUT4 receptors. It improves the blood circulation. It also will help in the preventing the bone loss. So when we are exercising, we are incorporating certain exercise for the bone also. So these are multifocal. So exercise has a main role in improving our lifestyle. I mean promoting the healthy lifestyle. It also exercise is very good for your stress also because it will improve the hormone. It will flush out the hormone cortisol, which is the main culprit for your stress. So by promoting and after exercise, you will get a good sleep, and thus it will help you in preventing the cardiac diseases. So how much exercise one should do? Aim is for at least 30 to 60 minutes of activity daily. Now again, if I'm talking about the exercise, we have to keep in the mind the risk, which are the patients who are included in prehab. Again, I just emphasize, we are talking about this are for the healthy individual who are not with the cardiac disease, right? So 150 minutes a week of moderate aerobic exercise, such as walking at a brisk pace, which is equivalent to around 3 to 6 minutes of activity or approximately 600 to 1200 calorie expenditure per week, or 60 to 75% of your heart rate reserve. 75 minutes of week, 75 minutes a week of vigorous aerobic activity, such as running you can include, or some strength training. As we say that we have to take care of our bone health also, and hence we must include certain strength training. So what type of the exercise one must include? So warm up and cool down are the most important part of your exercise regimen, which will include your flexibility of your lower limb, your back, your abdomen. So include the flexibility. So you warm up, prepare your heart to pump the blood, and then go for the aerobic exercise, which will be, as I just said, it could be 30 to 60 minutes of your aerobic exercise. So it could be in the form of treadmill, cycling, you're going to any gym, or it may be just an aerobic exercise in the form of you maybe just a free aerobic exercise in the form of dance, or you can incorporate certain recreational activity. At least 2 or 3 times in a week, you should put yourself for the certain recreational activity, which could be a swimming or some badminton playing or any games which you may be included as your hobbies. So this should be included. Not to forget our strength training, which could be just a dumbbell or maybe TheraBand, or maybe you are going to gym and using a sophisticated equipment. But that's what I'm trying to say, that one need not go to gym to do it. You can do all these activities at home in order to promote your health, like healthy heart. So most physical activity should be moderate intensity aerobic activity. Vigorous intensity aerobic activity should be included at least 3 days a week. Muscle strengthening activity should be included at least 3 times in a week. So you can have 3 times in a week strength training, then another 2 or 3 days of aerobic activities. Bone strengthening activity should be included at least 3 days a week. So all this should be incorporated when you are planning an exercise program. Hence, take-home messages: don't wait for a heart attack to take an action. Don't wait for a second life. Heart disease is avoidable. Follow healthy lifestyle. Incorporate heart healthy habits. So eat a nutritious food which is high in fibers, less in calories, maintain a healthy weight, always lead an active lifestyle, don't smoke, and keep yourself away from the alcohol. Thank you.
Thank you so much, ma'am, for this informative talk. I'm very sure our viewers have learned a great deal today and have become much more inspired to make a change in their lifestyle and, of course, have a healthy heart. I wish everyone once again a very happy World Heart Day, and stay tuned with us for the upcoming session, which will be soon released this week.